Good morning. Thank you for the invitation. Diabetes represents one of the most common diseases among people in the whole world. The number of people with diabetes mellitus is increasing. There has been a rapid advancement in the basic development of new technologies and therapies for the management of diabetes over the past decade. The diabetes control complication trial conclusively established that tight glycemic control with intensive insulin therapy decreases the rates of complications. Therefore, new diabetes technologies have accordingly been developed to help patients and reach these goals. Insulin therapy has greatly advanced to the development of rapid-acting and ultra-rapid-acting insulin analogs. Rapid-acting insulin analogs requires injection up to 10 to 15 minutes before meal intake for optimal action. Ultra-rapid-acting insulins have even faster on-off kinetics of rapid-acting insulin. Insulin has been traditionally administered via multiple daily injection via insulin syringe or insulin pen. Smart pen technologies pair the insulin pen with a smartphone to allow patients to more easily calculate and track insulin administration. The InPen, the companion medical, is FDA approved, although others are in development. The InPen connects with a smartphone application via Bluetooth, allowing patients to track insulin dosing history, calculate insulin doses, adjust calculated dosing accordingly, and set dosing reminders. In addition, patients can export data and collect them from the application and share them with their healthcare team. Insulin pumps deliver a continuous infusion via cannula placed in the subcutaneous tissue. Most of the pumps available use an infusion set with tubing to deliver insulin system, but say systems known as patch pumps attack directly to the skin without the need for tubing. Insulin pumps have track insulin users and contain bolus calculators to assist in the calculation of mealtime insulin coverage and glucose corrections. Accordingly to a systemic review and a meta-analysis, both multiple daily injections and pump therapy can result in comparable levels of glycemic control and incidence of severe hypoglycemia. But pump therapy may have favorable effects on glycemic control. Insulin pump permit a more flexible and physiologic insulin delivery that can be changed based on the time and other factors such as exercise, as well as varied delivery mealtime insulin based on the time of food consumed. In addition, the pump therapy eliminates the need for multiple daily injections of insulin instead of requiring only infusion set to be changed every 2 to 3 days. Real-time continuous glucose monitoring is a wearable technology that provides real-time continuous glucose measurements with the option of alert for hyper or hypoglycemia or projected glucose out of target ranges. Real-time continuous glucose monitoring actively transmits glucose information to a dedicated receiver, an insulin pump or a smartphone or watch, and to a cloud network if desired, and can provide real-time information to the user regarding the rate of glucose change, the hyper or hypoglycemia based on individualized thresholds, and impeding hypoglycemia alarms based on glucose trends. The flash glucose monitoring is a system in which data are restored in a wearable sensor and obtained by scanning the sensor with dedicated receiver or smartphone. In this system, the other name is Freestyle Libre. Data are restored within the sensor. It can be obtained by scanning the device with dedicated receiver or smartphone. Both devices, continuous glucose monitoring and flash glucose monitoring, measure interstitial glucose via a transcutaneous sensor, a filament placed in the subcutaneous system, tissue, and connected to an overlying transmitter. Both devices can be used in blinded mode to record glucose data on the device for later analysis of glycemic patterns and to assist healthcare professionals in making therapeutic decisions. Okay. More recently, a continuous glucose monitoring system with an implantable sensor with an externally worn transmitter, the Senseonics Eversense, has been approved. About the automated insulin delivery system, these are kind of systems also known as closed loop, artificial pancreas, or bionic pancreas systems. These are real-time glucose measurements fed into a control algorithm that automatically adjusts the rate of subcutaneous insulin delivery via an insulin pump. Later generations of these kind of systems entail more complex algorithms, not only to suspend insulin delivery based on hypoglycemia, but continuously adjust insulin delivery in response to glycemic trends. Currently, FDA has approved a hybrid closed loop system, include the Medtronic 670G and Tandem T SlimX2 with IQ control. This kind of system can be used as a traditional pump, or can put in auto mode, in which the pump automatically adjusts basal insulin range up to every 5 minutes by increasing, decreasing, or suspending delivery of insulin based on continuous glucose monitoring trends. As a safety feature, the system may exit auto mode and revert to a pre-programmed delivery if insulin approaches minimum, maximum, or if the signal can be lost. The negative points of this kind of system is the number of alarms, the challenges with requiring calibration, and the dissatisfaction of the patients about the glycemic control. About the experimental systems, we have the Omnipod Horizon closed loop system, the bihormonal or dual hormone system that is capable of delivering a second hormone to further improve the glycemic control. Given the kinetics of the subcutaneous insulin delivery, the reduction or suspension of insulin may be insufficient to prevent hypoglycemia, especially in certain scenarios that may result in changes such as an extensive exercise. Several bihormonal systems use microdosing of glucagon to prevent and treat hypoglycemia when suspension of insulin delivery is not sufficient. In short-term studies, if bihormonal systems patient achieved increased time in target range, lower mean glucose, and decreased rates of hypoglycemia compared with a sensor-augmented pump therapy, and in additional studies comparing bihormonal with insulin-only closed-loop systems, suggest that bihormonal systems may further improve mean glucose time in range, as well as reduce the time spent in hypoglycemic ranges. Other classes of dual hormone systems that have been studied administer pramlitide, an amylin analog, or a GLP-1 receptor agonist in combination with insulin. Amylin is co-secreted with insulin from pancreatic beta cells and helps moderate postprandial glucose excursions by slowing gastric emptying, inhibiting glucagon secretion, and promoting satiety. Long-term studies of bihormonal systems are needed to establish their potential benefits, and further researches in the next year should determine the long-term benefits of these devices on glycemic control and quality of life. Thank you.